Chapter 6: Skipping Scoliosis Surgery. Modern non-surgical, whole-body approaches to scoliosis care. A new way of thinking about scoliosis. When many people hear the word scoliosis, they picture a crooked spine on an X-ray and imagine that the only real solution is a brace or a surgery with metal rods. Yet today's research, combined with decades of patient experience, shows us something very different. Scoliosis is not just a bone problem. It is a whole body, whole life condition that involves muscles, nerves, balance centers in the brain, and even how our genes tell tissues to grow and heal. Because scoliosis touches so many systems, the most effective care plans are also wide-ranging. They train the brain to guide better posture, strengthen muscles to hold new patterns, and support bones, collagen, and discs from the inside out. In this chapter, we will explore 4 modern non-surgical strategies: ScoliSMART reflexive-response rehabilitation, Schroth-based physiotherapeutic exercises, movement therapeutics like yoga and Pilates, and metabolic-genetic personalization, and then explain why long-term monitoring and daily self-care make all the difference. Together, these methods form a powerful toolkit that can help many people reduce curve progression, improve comfort, and boost confidence without ever entering an operating room. ScoliSMART reflexive-response rehabilitation. ScoliSMART is a brain and muscle training system designed specifically for scoliosis. The program uses a light, flexible activity suit and a brief boot camp-style intensive to jump-start learning. Instead of forcing the spine straight, the suit places gentle resistance bands in smart locations. When a person walks, bends, or reaches, the bands tug just enough to remind key muscles and reflexes to fire in a balanced way. Over time, the brain begins to adopt this balanced pattern automatically, hence the term reflexive response. How it works in plain English. Think of the spine as the mast of a tall sailboat, and the muscles as its ropes. If one side's ropes tighten more than the other, the mast tilts. Bracing tries to hold the mast still with a hard shell. ScoliSMART teaches the sailor, the brain, to pull the ropes evenly. During the initial 5 to 10-day boot camp, therapists guide patients through daily sessions of core strength moves, balance drills, and respiratory training while wearing the suit. After the intensive part, the person keeps the suit and continues shorter sessions at home, often 15 to 20 minutes a day, several days a week. Why it helps. Builds muscle memory. Because the cues happen while moving, not while sitting still, the learned pattern carries over into sports, walking, and everyday life. Encourages growth in a better direction. In children and teens, bones are still forming. Balanced muscle pull can help guide them straighter, similar to how braces align teeth. Improves posture awareness. The gentle pull reminds users to stand taller and engage their core. What the evidence shows. Published reports and clinic data note average Cobb-Engel reductions of 9 to 15 degrees and stabilization in many larger curves. Equally important, parents and teens report less back fatigue, better athletic performance, and improved body image. While results vary, these outcomes highlight how active, brain-driven rehab can rival or surpass passive methods like bracing for many patients. Schroth-based PSSE, physiotherapeutic scoliosis-specific exercises. Developed in Germany nearly a century ago and refined ever since, Schroth therapy is a set of scoliosis-specific positions and breathing techniques. Certified therapists assess each curve pattern, then teach personalized exercises that lengthen tight muscles, strengthen weak ones, and expand collapsed areas of the rib cage. The PSSE label simply means these are physiotherapeutic, physical therapy, moves designed only for scoliosis. Core principles 3-dimensional correction. Each exercise addresses side to side, front to back, and rotational components of the curve. Rotational angular breathing. Deep, targeted breaths help open the concave side of the rib cage, improving lung function and chest symmetry. Posture integration. Once a patient masters a position, the goal is to apply that posture in real life, sitting at school, carrying a backpack, or shooting a basketball. Evidence for success. Peer-reviewed studies suggest that consistent Schroth practice, often 30 to 45 minutes a day, 5 days a week, can slow or stop curve progression and sometimes reduce Cobb angles by several degrees. However, most benefits are limited to the gains in quality of life: less pain, higher self-esteem, and better scores on daily activity questionnaires. One controlled study found that teens who practiced Schroth plus standard care improved 2 to 3 times more than those who used standard care alone. Movement therapeutics: yoga, Pilates, and balance board drills. Sports, dance, and playground time certainly support a healthy spine, but movement therapeutics go a step further. These are specialized classes or routines that blend yoga, Pilates, and balance board work, all tweaked to respect and correct each person's unique curve pattern. Key goals: symmetry training. In scoliosis, one side of the body often dominates. Targeted poses stretch the tight side and strengthen the weaker side. Core control. Pilates-style mat work builds deep abdominal and back muscles, which act like a natural brace. Dynamic balance. Standing on a wobble or rocker board challenges reflexes and spinal stabilizers, teaching the body to react quickly to shifts in weight. Real-world benefits. Participants frequently notice better flexibility, easier breathing, and improved sports performance within weeks. Studies report modest but meaningful Cobb angle improvements, especially when movement therapeutics are combined with a structured program like Schroth or ScoliSMART. Equally significant is the mental boost. Many teens feel calmer and more in tune with their bodies after yoga or Pilates sessions, lowering stress hormones that can otherwise weaken bone and collagen. Safety tips. Because some generic yoga or gym classes include twists or deep back bends that could worsen certain curves, instruction from a scoliosis-aware teacher is important. Simple rule: if a pose causes pain or makes the rib hump stick out further, modify or skip it. Metabolic and genetic personalization. Bones, muscles, and connective tissues are living, changing structures. They rely on hormones like estrogen and growth hormone, neurotransmitters such as serotonin and dopamine, and genetic signals coded in DNA. Variations in these systems can tilt the playing field toward faster curve growth or weaker support tissues. Metabolic and genetic personalization aims to discover those hidden factors and correct or balance them. Common tests. Neurotransmitter panels. Simple urine or saliva kits can measure serotonin, dopamine, norepinephrine, and histamine. Hormone profiles. Blood or saliva samples track estrogen, progesterone, cortisol, vitamin D, and other bone-building signals. SNP, single nucleotide polymorphism panels. Gene tests look for variants like MTHFR, COMT, and COL1A1 that may affect collagen quality, detox pathways, or bone density. Targeted actions. Nutrient therapy. Using specific vitamins, minerals, or amino acids to boost neurotransmitter balance. For example, tryptophan or 5-HTP can raise serotonin, which supports muscle coordination. Hormone support. Vitamin D and K2 for better calcium use, or plant-based phytoestrogens for girls with low estrogen. Collagen boosters. Vitamin C, lysine, and marine collagen powders can strengthen ligaments and discs. Evidence and outcomes. Early studies and clinical observations show that correcting low serotonin, high histamine, or weak collagen markers can slow curve growth, reduce pain, and improve exercise tolerance. While more large-scale trials are needed, the personalized approach matches a broader move in medicine toward precision health, where one size no longer fits all. The lifelong journey, why follow-up never ends. Whether someone chooses active rehab, braces, surgery, or a mix, scoliosis management is truly lifelong. Curves can behave unpredictably during growth spurts, pregnancy, menopause, or times of illness. Muscles can weaken with age or long hours at a desk. Because of these variables, ongoing monitoring and posture training remain vital. Smart habits to keep regular checkups. Kids and teens, every 6 months while growing. Adults, every 1 to 2 years or sooner if pain arises. Daily posture minutes. Even 5-minute micro breaks to stand tall, breathe deeply, and engage the core can reset neural patterns. Seasonal tune-ups. Many clinics offer short refresher visits or weekend camps where patients review exercises, update suit fits, and adjust metabolic plans. Active lifestyle. Walking, swimming, cycling, and strength training keep supporting muscles strong and joints flexible. Listening to the body. Pain, fatigue, or new unevenness are early warning signs. Addressing them quickly, perhaps with extra therapy sessions or a tweak in supplements, can prevent larger setbacks. Success stories that inspire. Maria, age 13, diagnosed with a 35-degree thoracic curve. After joining a 5-day ScoliSMART boot camp and practicing suit walks at home, her curve held steady for 2 years and then dropped to 26 degrees even as she hit her growth peak. She now plays varsity volleyball without pain. Devin, age 17, entered care with a 42-degree lumbar curve and high histamine on metabolic testing. Targeted nutrient therapy plus Pilates and balance drills cut daily backaches in half. His curve is still 42 degrees, but he avoids surgery and enjoys martial arts. Linda, age 45, had a childhood curve that grew slowly to 55 degrees. Too flexible for fusion, she adopted yoga-based movement therapeutics and vitamin D plus collagen support. After 1 year, she reported better sleep, a 2-centimeter improvement in forward bend rotation, and lower stress. These stories remind us that goals differ. Some patients seek angle improvement, others aim for pain-free living or athletic confidence. All 3 achieved meaningful wins without surgery. Common questions, straight answers. Can non-surgical methods really stop every curve? No plan is perfect. Very aggressive curves can still progress despite best efforts. Yet modern programs often slow growth long enough for bones to mature, shrinking the window where surgery feels urgent. Isn't a brace easier than daily exercise? Braces seem simple. Strap it on and go. But long wear, hours, skin issues, and social stress can be tough. Many teens find 30 to 40 minutes of active training per day less disruptive and more empowering. What if I already had fusion? Whole body care still matters. Post-fusion patients can use modified Schroth, yoga, and metabolic support to keep unfused areas healthy and avoid adjacent segment problems. Final thoughts. Empowerment over fear. Modern non-surgical scoliosis care flips the focus from holding a spine still to teaching it better alignment and supporting it from the inside out. ScoliSMART reflexive-response rehabilitation trains neural pathways. Schroth-based PSSE rewires posture and breath. Movement therapeutics build balanced strength. Metabolic-genetic personalization fuels stronger bones and tissues. None of these tools is magic on its own, but together, and practiced over years rather than weeks, they give children, teens, and adults the chance to live active, confident lives on their own terms. Remember, scoliosis management is a marathon, not a sprint. It asks for curiosity, patience, and regular tune-ups, just like caring for a classic car or learning a musical instrument. The reward for that steady work is priceless. A body that moves with freedom, a mind that feels proud and calm, and a future where the curve no longer calls the shots. You do. Chapter 6. Skipping Scoliosis Surgery. Modern non-surgical whole body approaches to scoliosis care.